So after all the shorts of my birth trauma story, I couldn't get the time to change back to 3 minutes, so then it was only allowing me to do 15 seconds, so I can't really keep talking in 15-second increments. But yeah, so ended up with a hysterectomy after a very normal pregnancy, healthy pregnancy. And my birth, my labor was long, and I think the reason why it was so long is because I was holding a lot of maybe tension, and I had so much pain. And even though I wanted to have a natural delivery, no medications at all, because I knew that medications add interventions and then complications, and I've seen that as a nurse. So I was trying to avoid all that by just not taking any pain medicine, not taking the epidural, because then you lose the freedom of movement. I gave in to getting the epidural because I had such severe pain, and the natural classes I had taken and all the books I read said, you have a peak, and then the peak goes away, and then you have a break after your contraction, and that was not the case for me. I had an OP baby with rupture of membranes at the start of my labor, so it was initially intense, and it stayed intense, and it got severe, and to the point where I was begging for death. My day shift nurse, who was great, who was moving me around and trying to help me have a natural birth, I was begging her to shoot me in the face every contraction, because the contraction would come, and yeah, my stomach would hurt a lot, but that was bearable. What really hurt was the bone pain I was having, and it felt like my body was trying to push out my pelvis, because that's basically what it was trying to do, because my baby was stuck on my pelvis. And there was no cushion because the water bag was completely gone. When my water broke at 1:45 in the morning, it ruptured like the movies, like in the movie Conehead. So it was just this huge rupture of waters. I was completely soaked immediately, and it just kept soaking me for hours on end. So there was no cushion left. And I had an anterior placenta, and I guess that can increase your chance of getting an OP position baby. And then PROM increases your chance of getting an OP position baby because they don't have the fluid to move around. And then her head size was large. It was like in the upper 90 percentiles. And I'm not like a super hippie woman. Like, I have, I think, normal sized hips, but I don't know. My pelvis might be not super wide, so I don't think it could accommodate all of those factors, and I really needed her to be positioned the right way. And most OBs can reposition your baby manually, like push the head up a little bit and then kind of rotate. But my OB, when I asked for something other than C-section, when she said I was fully dilated and she was wanting to C-section me, I said, well, I at least want to try, push. I want to try pushing her out myself. And I'm like, is there anything else we can do? And she said, I could shove her back up in you and you could start all over. Well, nobody would take that option, if it's advertised like that. So I was like, no, I'm just going to keep trying. And I had the epidural on at this point, so I couldn't really move my legs. And the nurses kept putting me on my left side. And that's pretty much it. Sometimes they'd try to put me on my butt, but I was always on my pelvis, and I said, I need to get in hands and knees to push this baby out because nothing's expanding and she's stuck. And they wouldn't listen to me. They're like, you're too numb to go in hands and knees. And I said, I brought a bunch of my own pillows. I have my husband here. He's strong. We can do this. They're like, no, it's not safe. I'm like, I'm very strong. If you just flip me, I'll hold myself up. No, we can't do it. So all they would do is let me stay on the left side, to the point where my left leg swelled so much that I thought I had a blood clot. And my nurses were like, I don't think it's a blood clot. Didn't tell the provider or anything. Didn't try moving me around. And then all the while my nurses are shoving monitors on my stomach every contraction. Mind you, every contraction is stacked, so I don't get breaks in between contractions. And I don't have Pitocin on or anything. It's just the nature of a malpositioned baby. Because what happens is your uterus is pushing the baby out, and then your baby hits something hard like a pelvis and bounces basically back up into the uterus. And so it's this never-ending loop of feedback to the uterus to continue to contract. So, my peak of contraction would happen, and I would just have searing, blinding bone pain. And I wanted to escape my body. So that's why I got the epidural. But the baby was stuck on my right side, and they had me on my left side. So the epidural went all to my left side and didn't numb my right side at all. So I could still move my right side. So I could still feel the pain. And my nurses were literally shoving the monitor onto my belly with each contraction because they were worried she was having D cells, my baby. But I said, you need to just move those monitors lower because that's where she's heading. She's heading lower. You just need to glide it lower. You don't need to shove deeper into my stomach. But they didn't care. And they're like, no, we're trying to find her. And I was like, okay, can you just put an internal monitor on so that we can stop worrying about her heart rate? Because I can feel her kicking and I know she's fine. And they're like, no, it's not clinically indicated. And I said, well, what would make it clinically indicated? And they're like, trouble monitoring externally. I'm like, well, that's what we're dealing with. But they refused to give me an internal monitor. So, and then they wanted me to practice pushing. And I did a few times just to placate them, to play by their rules and try to remain in rapport with these people who have control over me. And then I finally said, no, I'm not practice pushing anymore because that's dumb. You know, your body knows when to push. And I'm like, I've seen unconscious women have babies who are intubated during COVID times, you know. So it's like, your body knows how to push. You don't need to be told to push. And I can still feel enough to push. I just need to be in hands and knees because there's no expansion happening in my pelvis. You know, this is obvious to me, but not to them, apparently. I should add that one of my nurses was in training still. This was like her last day of orientation. So she was there with another nurse teaching her. And neither of them were good. Both of them were sitting on their butt the whole time, barely interacting with me except to hurt me. And anytime I asked for something different, they refused. You know, and it's like, I'm a nurse. I know what I'm entitled to. I know what the policies say. I know what the algorithm is. And so there's no reason to not get a external monitor, to be switched out for like a cordless monitor or to be switched in for an internal monitor if I need it. There's no reason they couldn't have put me in hands and knees. There's just so many things they could have done better to support me. There's no reason to tell me to push. And so I finally said, I just need to rest. And they really didn't want me to. And I said, I just need to sleep. Like, I've worked night shift and 24-hour shifts my entire nursing career, and I've never felt exhaustion like that. And it felt like the sand of my life was rapidly depleting, and I only had a little bit of energy left. So I was trying to regain a little bit of strength for pushing. And the whole time they were in the room, pushing the monitor into my abdomen, yanking on my bladder because the catheter was not properly anchored. And as I was trying to sleep, they would just hurt me and hurt me. And I said, hey, this catheter is not anchored correctly. Can you please anchor it correctly? Which means you need to just pop open the Y lock. It's like, it looks like a Y. And put the Y port of the catheter in that Y lock. And then it will lock the catheter. But instead, just the tube was free in that Y lock. So every time they moved me, it yanked on my bladder. And so I said, hey, this isn't actually locked right. And they didn't want to mess with it. And then they couldn't open the lock correctly because, I don't know, they're freaking ridiculous. They don't know how to do anything. So then they just put a new stat lock on. And they properly locked it. And then they ripped off the previous stat lock. And no skin prep was ever used for either of these stat locks. So it left a scar on my leg. And I kept telling her while she was picking at it, while I was trying to take a nap and rest, I said, just leave it. Just leave it. Just leave the old sticker on. It's fine. And she just kept doing it. She would not listen to me. She just kept touching me and hurting me. And I said, please stop. And then she yanked it off. And yeah, I mean, my whole leg was red in that area. And it stayed like that for months. No joke. And I just... like, I can't imagine treating any patient like that, let alone somebody who's in a very painful, long labor. Mind you, my water broke at 1:45 in the morning, and I'm into the next day, into the nighttime. This is night shift. And, you know, she's just not listening to me. So, finally, when they wouldn't let me sleep, me trying for like an hour to sleep, them just chit-chatting in the room, I said, hey, how can I get you out of here? And they said, we can't leave because you're on the epidural and you're in pushing phase. and you need continuous monitoring. And I said, okay, let's turn the epidural off, and then I want you out. And they're like, well, we still have to continuously monitor you. And I'm like, not if I don't have the epidural on. And they're like, no, it's our policy. I'm like, I'm going to hold my monitors myself. I will monitor myself. I need you out of the room. And they just kept telling me policy this, policy that. And I'm like, I don't care. You need to get out. I'm like, get the fuck out. And I started cussing at them and being mean because they're not listening to me. They're just hurting me. I'm realizing that I'm in a very dire situation where I'm either going to die or have to get a C-section. And so the only thing I can do is get them out of the room so I can reposition myself. So I got them to turn off the epidural. I found out I was hooked up to fluids, which was not something they were supposed to do because my birth plan said limit fluids to only what is necessary. So I was only supposed to get a 1/2 liter bag prior to the walking epidural, and then a 1/2 liter bag started prior to the full epidural. Never had low blood pressure during my labor, so I shouldn't have had bag after bag of fluid. And I was like, well, this is why my leg is super swollen. So I disconnected that, and they charted that I was like being non-compliant, of course, because I'm supposed to play by their rules apparently. And I kicked them all out. Then their charge nurse comes in the room, and she's putting AMA papers in my face saying I should sign these because I'm going to kill my baby, and it's just to not hold the hospital liable since I'm letting myself kill my baby. And I said, no, I'm not signing shit. I don't want my baby to die. I'm doing this so that I can have a vaginal birth and have a healthy baby and me. And she didn't care. She wanted me to sign. And I was like, no, I'm not signing that. Get out. And so I kicked her out. At some point there was a break nurse who came in and checked on me too. And I told her to get out too and to not touch me because I was monitoring myself. So they just charted really nasty things. I have my entire chart, so I know what they said about me. Like I was this crazy hysterical person, and they just framed it in a way that wasn't true. Like I was refusing monitoring, and I wasn't. I asked for internal monitoring, and they refused that. And I just wanted them to stop shoving the monitor into my contracting uterus. That's all I was asking for. But apparently that's too much. You know, and I'm not having normal contractions. I'm having OP contractions. So the baby's stuck in my pelvis, and it's causing me bone pain, which I still have 14 months later. By the way, my nurse had never had a baby before, so she had no idea the pain she was causing me, and she had absolutely no sympathy in the world for me. Yeah, I'm also breastfeeding my baby and trying to keep her asleep right now, so we'll see how long that lasts. So, where was I? Kicked him out, started doing a mile circuit. That takes about 90 minutes. And I had my husband flip me into hands and knees. And then I just like tucked pillows and tried to meditate to get the pain to stay away and rotate the baby. And I felt the baby come out of my pelvis a little bit. And I was like, I'm going to have this baby. And these people are going to feel so stupid because I'm going to do this by myself. And, you do various movements in the mile circuit, and the last one is like uneven hip movement, so I was like doing lunges in the bed and stuff. And then I had enough feeling back in my left leg to where I felt safe going to the bathroom, so I took all the monitors off of me and asked my husband to help me to the bathroom, and I was just gonna shit out the baby in the toilet because I had like a strong urge to push like I hadn't before. And so we made our way to the bathroom, and of course, because I was off the monitors, the nurses came right back in and yelling at me and saying I need to be in the bed and all this crap. And then the one nurse was like, you sound like you're gonna have a baby. And I'm like, I hope so. And I'm like, can you just check to see? Because my husband said that it was swelling down there, so maybe there's been a change. And she said she still didn't see crowning. And then it was like at that point where I just felt like no hope, because the last station the baby was at was zero station. So I said, okay, I'll go back to the bed, get the OB back in here to officially check me to make sure it's accurate and to see if I've made any progress turning her or getting her lower in my pelvis, and then we'll make a choice. And getting back into the bed was very painful, and then being in bed was excruciating and everybody in my face, to where I was begging for the epidural again, because I could feel myself like leaving my trance of keeping the pain away. And with everybody in my face again, it was like fight or flight all over again. What else was I going to say? I can't remember. So anyway, the OB came back in the room and she checked me and she said, okay, I think now you're at +1 station, but the baby's still kind of OP. She's like, she might have turned a little bit, but she's still kind of OP is what she said. And I still think you should C-section. And I just had visions of the baby dying. And I said, okay. And I was like biting the mattress as I was saying it. I was like in so much pain and I was begging for the epidural. And the initial plan was let the epidural take effect, then have the OB come in and talk to me so that I can make a decision. And my husband's begging me not to do C-section because that wasn't in the plan. And, you know, the baby's okay right now. But I was just worried that things could go wrong. And it's like I've already tried for 90 minutes now to 2 hours by myself, and they're basically telling me I didn't make enough progress. And at this point I'm pushing for allegedly 5 hours, but reality I'd only really been trying for the last 30 minutes or so of my Miles circuit because I didn't have the urge previously. So I was like, okay, let's just sign and do the consent. And I'm like not even looking at the consent papers, and my OB's like, Melissa, you need to sign here, let me consent you. And she never said anything about risk of hysterectomy, although she charted that she extensively went over the risk of hysterectomy, which as a nurse I know that's a risk of birth is hysterectomy, because you could bleed to death and just that's the only way to save you sometimes. So anyway, I signed consent for that, and then I went to C-section, and then when the epidural finally took effect again, I was like, what am I doing? I don't want to do this. And I was like, I'm the only one in my family who's had a C-section, so in my mind, genetically, I should be physically capable of birthing my own child. But they're telling me I'm not. So I was like, I guess I'll just stick to the plan of C-section now, because I don't want to, like, they're already preparing for that, even though everything in me was like, I shouldn't be doing this. Anyway, C-section happens, and my baby has a cone head, like, pretty decent looking cone head, and she's like, oh, her head bones didn't model very well. And I'm like, I'm looking at a cone head, like she was in my pelvis. And then the nurses, when they were showing me the placenta later, because I asked them to, they're like, yeah, her cord's kind of skinny. Maybe that's why she was having decels. Like, just trying to justify why they were the way they were to me. And I'm like, that's a normal placenta. That's a normal cord, 3-vessel cord. There's nothing wrong with it. There's no blood in it now because it's been cut. But it's normal. It's not too skinny. I've seen lots of umbilical cords as a flight nurse and, you know, all that. So it's just crazy to me. They're trying to gaslight me that, oh, this was a necessary C-section. Because I don't think it was. So anyway, I'm just apologizing to my baby and crying and so sorry that I put her through this horrendous labor and that I consented to drugs and then I consented to a C-section. I'm so sorry that I put her at risk, and then I like pushed so hard, and you know, maybe I should have C-sectioned sooner, maybe I shouldn't have C-sectioned at all, and now she's not exposed to the normal birth path, so how will that affect her, you know? So all of that was running through my head. And then I'm in recovery and I'm latching the baby, and breastfeeding's going well. Like, she latched immediately and she wasn't crying with me and stuff. And then the nurses, I noticed, are changing blood pressure cuffs from arm to arm repeatedly. And I'm just like, God, they will not stop touching me and annoying me. And then I look over at them and the whole world spins. And I start having black spots in my vision. And I'm like, what's my blood pressure? And they're like, it's low, we're rechecking it. After like switching out my blood pressure cuff over and over again. And then I say to Alan, I'm like, my husband, what's my blood pressure? And he's like 70/40. And that's when the disaster starts. So, you know, this whole time I'm just thinking, I'm so excited to just sleep. And so is my husband. And I'm sure so is my baby. And then, you know, then I ended up having a 12-liter hemorrhage, which some people might not know that's possible. It's possible because as they give you blood, you still hemorrhage that blood out and you count up the entire total. My total was about 12 liters, counting the emergent hysterectomy they had to do. When they opened me up for my hysterectomy, they saw the laceration in the uterus, in the cervix, and the vagina. And I had asked to try to keep my cervix if possible, because I know that means better healing and stuff. But they said that wasn't possible because the cervix was severely lacerated and it was falling apart in their hands. So they had to yank it and then stitch the top of the vagina shut, repair the vagina laceration, and then connect that, I guess, to uterosacral ligament and close me up. And they said there was like 4 liters of blood in my abdomen, and then there was like another liter of blood in my reproductive tract and a liter of clot in my reproductive tract they took out. So it's like 5 or so, 6 or so during the hysterectomy that they discovered. So yeah, a lot of bleeding. My nurse in high-risk maternity argued with how much blood I had lost because she only read one part of the chart. And she was like, you didn't bleed that much. And I'm like, no, I did. You have to add it all up in a, 2-day period because I had her August 24th. And then I had my hysterectomy August 25th. My membranes ruptured August 23rd at 1:45 in the morning. So it's a very long process for me. And then I was in the hospital for 10 days. And the whole time, like, medical professionals trying to gaslight me and say that I didn't have happen what happened. And then, like, not reading the chart all the way. My different providers, my different nurses. And I spoke with House Soup a couple times, and I don't know who else, but the patient complaint department and stuff. I don't know. I tried to really emphasize that, hey, had they given me a mass transfusion sooner, I would have been better. Had they changed the doctors sooner, I'd have been better. If they would have sent me straight to embolization, I wouldn't have needed a hysterectomy. If they would have put an IO in, I wouldn't have almost died. If they would have just used their hemostat checker to check my hemoglobin, they would have had an idea of my hemoglobin without actually having to draw a lab. Because the lowest hemoglobin they checked with the rapid response team with the hemostat checker was 4. So come down from 13 initially. So there's all these things they could have done differently. And now I'm very much aware of what's causing our high mortality rate in women. Mostly what kills us is postpartum hemorrhage. And we have a third of us getting C-sections. So they list the number one cause of hemorrhage as uterine atony, which is what I was diagnosed with. And atony, it's not always the cause of your hemorrhage. Sometimes it's telling you about another problem. Sometimes it's the symptom. So I think instead of women dying in droves from uterine atony, I think what we're dying from is surgical error. And I don't know how in-depth the medical exams are post-mortem of these dead women so we can understand what's actually killing us, because I should be dead right now and nobody would know what actually killed me, because my husband was told over and over it was uterine atony and it was my fault because I had a long labor and I should have let them C-section me sooner. I really think that my baby was fine. Like, her APGARs were perfect, and I think she would have been just fine having a vaginal birth, and I just needed to stay in hands and knees longer. And if I had been helped from the beginning in that way, I don't think I would have needed the C-section, but, they scared me into it, and I knew I wouldn't forgive myself if I just continued to push for vaginal delivery, and she died. So I am happy that my baby's healthy and fine. And if that's the only way I could have had her safely, fine. I just wish my doctor was better at holding a knife. I wish she was better at holding a JADA device. I wish she was better at ordering blood and using her eyeballs to assess somebody. Wish my ICU doctor was better at assessing somebody, because I was hemorrhaging still in the ICU and nobody cared. Nobody listened to my pain. Nobody took my drops in blood pressure and hemoglobin seriously. And, that's the fault of the nurses and the doctors. Because when I have a patient as a nurse in the ICU, I've worked ER, cardiac ICU, and flight. I'm mean to doctors until they do something about the patient. I do not let my doctors sit on somebody who's high risk and do nothing. I know the treatment plans that should happen for a patient displaying certain symptoms. And if my doctors decide to be cheap and lazy, I identify that and I call it out and I tell them what they should be doing instead. So to me, it's a huge failure on the doctors and the nurses who didn't notice that I was still hemorrhaging in the ICU, as well as in immediate postpartum when I was in the PACU recovering immediately from the C-section. And I'm somebody that's very, very fast and efficient. So it really kills me when I see people like sitting on their computers and charting. You have a patient that's dying and, it took a long time when the nurses told me that my blood pressure was low, 70/40, for the doctor to even get to the bedside. And I said to them, just call a rapid response. And they're like, no, we're going to wait for the doctor. They were very rude to me the whole time. Like, I'm the patient. I'm hemorrhaging. This is tragic. We need to do something. This is an emergency. I'm going blind. My chest is hurting. We're going to wait for the doctor. I puked on my baby. I said, can somebody please wrap up the baby and hand her to my husband? And then once she was out of my arms, I could focus on trying to stay alive and yelling at people to try to get them to do the right thing. But what I learned is, I thought throughout pregnancy that you just have to know what to say to people. You just have to know how to advocate. But I knew how to advocate. I knew what to say to people, and they ignored me. So it's not the women that's the problem. It's not the lack of advocacy. It's not the lack of knowledge that the patient has. It's the medical providers that are at the bedside ignoring their patient's symptoms. And I'm like, my whole life I grew up taking care of farm animals and helping with deliveries of goats and stuff, to the point where I even had to like manually reposition baby goats to get them out safely. I did that a lot. So I really love labor and delivery, and I've always wanted to be involved some way as a nurse, and I have in different capacities in the ER, cardiac ICU, and flight. I've taken care of high-risk obstetric patients and laboring women. So I know how to fetal monitor, and I know the stages of labor and emergent events and all that stuff. I know all the drugs they need to know. So I just thought, because I'm so knowledgeable and because I was healthy too, like I was working out really hard in pregnancy and very, very strong. I was deadlifting 100 pounds the day before my water broke, and squatting that, and also pushing a heavy sled because I was sick of being pregnant and it was my due date. So I was trying to have the baby. Baby's starting to wake up. Ended up having her at 40 weeks and 2 days. And I don't think it's smart to try to induce labor yourself, because I think it just ate up my reserve energy and made me more exhausted when I really needed energy for pushing and stuff. So anyway, I have a lot of guilt over what I could have done to make myself in a better position for birth, but there's no way I could have known that my medical team would fail me like that. And I was always okay with C-section if necessary, and even epidural if necessary, Pitocin if necessary. It's like, but I know when those things are necessary. So you're not going to trick me into pushing me to an intervention. But fear is real during labor, and you need to feel very, very safe to relax and open up. And I'm not the relaxed type, so I think that also added to my prolonged labor. I didn't have a doula. I think that would have helped me a lot to have somebody on my team. I wish I would have stayed home to have her, because I would have felt safer and I would have stayed in hands and knees, and I think I would have been able to do it. Like with a midwife and a doula, or a birth center would have been good, or even a more natural hospital with better statistics. Because there was a hospital like 20 minutes away who's known for water births and lack of epidurals and all that. So probably should have tried to have a baby there. But because I'm a scarred flight nurse and I've seen a lot of transfers. I thought at the last minute, I was like, I should have it at the best hospital, highest trauma center, and best NICU. And, fortunately my baby didn't need any NICU services, but I required a lot of expertise and help, and I was really failed. And I even think hysterectomy for postpartum hemorrhage is kind of a lazy fix. I think that, if it was any other organ, the surgeon would have to fix that organ. And, the fact you can cut me open for a C-section and then say, oh, but I can't fix your laceration from a jada, that feels very lazy to me. But, I don't know what it looked like. I wasn't there. And they also fail to give women blood soon enough after they start hemorrhaging, which is crazy. Because another study I read, and I already know this from nursing school, once a woman is showing signs of hemorrhage, you're already too late, postpartum wise, because we have a lot of extra blood. So if we're showing signs that we're hemorrhaging, you're behind the 8 ball. The fact that I was showing severe signs of hemorrhaging and near death vitals and signs, and they still weren't convinced enough to give me blood, it's like, that's crazy. So, and I'm a healthy person, healthy BMI. I work out, I lift weights and stuff. Have no medical issues, no issues in pregnancy, no issues with the baby. Genetically, all my family has had vaginal births, no problem. So, if I can almost die, it really makes me sickened for everybody else in the population who may not have those advantages going into labor, who aren't nurses and can't advocate for themselves. And it really makes me want to exhume all these women who have been buried, who are postpartum hemorrhage patients, and check to see if their artery is intact. I don't know the extent to post-mortem exams for postpartum hemorrhage, but I think that the solution lies with them. I think that it's a lot of surgical error. And you can have lacerations even with a vaginal birth that's deep enough to be severe. And I think there's a lot more we can do besides hysterectomy. And it's like, if you get on it quick and you give people blood quick and you send them to embolization quick, then you can avoid these other means of fixing it. And also, if we could CT women to see what's causing their bleed, start a mass transfusion, then CT me and realize, oh, the bleeding is coming from an artery. Okay, you need to go to embolization, versus you just have a boggy uterus. You need to have a jada that I know how to put in safely. If my doctor knew how to put in a jada safely, I would still have a uterus. So it's just really sad, because I put off having kids so that I could get really good in my career, because I like being a nurse. I like being a critical care nurse. I think it's a lot of fun and it's very impactful, and I've saved a lot of lives. There's a lot of people walking this earth because I spoke up for them and I did the right things. And there's a lot of policies I've had to break in order to save lives. And the patient's better for it, and everybody's thankful that I did that. But, it's like you have to be able to speak up for people. So it's sad because I put off having kids, and I was just going to start having my mommy time and have kids and stuff. And they took that from me after my first. So now my kid can't have a sibling unless I solicit some other woman's uterus, because I still have ovaries, or I adopt. And both of those situations have their own trauma that come with them. Anyway, I think I'm just going to keep posting about this kind of stuff, because I've done a lot of research since this has all happened, and I think there's a lot of solutions now that I've learned about, and also just processing grief and trauma. So I think I can help people by just saying my story. So anyway, that's it for right now.